With every single phone call, every postcard in the mail, every commercial that you'll ever see about Medicare, all of them, 100% of the time, are designed to play off one human emotion: fear. In this video, I'm going to share a real life conversation that I just had with a client and why, after poking holes through some phone solicitors' fear based sales tactics, which are questionable at best, tactics that you're going to learn to see right through after this video, she's more confident than ever as to why she chose to stay with her Medicare Advantage plan. So you finally did it. You settled in and you chose a Medicare Advantage plan. After doing all the research, weighing all of your Medicare options between Medicare supplements, Medicare Advantage plans, just agonizing about not wanting to make the wrong choice, figuring out your personal puzzle, including costs and benefits, you decided to go with a Medicare Advantage plan. Congratulations, right? So it's over, right? Like, time to live life again. The stress of turning 65 is over. Now you have 100% peace of mind. That is, until you get a phone call like one of my actual clients did that cast a massive shadow of doubt over everything she just did, and like a rock in your shoe, you can't shake it, and neither could she. So maybe you've been there, or maybe you're here, you're watching this video because of that kind of buyer's remorse. That's exactly what you're trying to avoid. Well, here's the exact email that she sent me, which led to a phone call a few minutes later. She says, "Hi, Adam, hope all's well with you. I've been getting a lot of calls saying that I should not have taken that Medicare Advantage plan. It's more out of pocket for me. I guess I'm asking because this is very confusing for me, and once you're in after 6 months, you cannot get out of it. Can you please clear this up for me? Thanks." Now, these are the calls that literally make my blood boil. They happen all the time, regardless of whether you're on Medicare supplements or a Medicare Advantage plan. It's because your name is on a list of people turning 65 who are already on Medicare that call centers and solicitors from all around the country can purchase and call 24/7. You probably know exactly what I'm talking about because these are the calls and the mailers that you've already gotten. But before I get to our conversation, here's secret number one for cutting through all the Medicare sales tactics from solicitors. With every single phone call, every postcard in the mail, every commercial that you'll ever see about Medicare, all of them, 100% of the time, are designed to play off one human emotion: fear. Fear of missing out, fear that you've made the wrong choice, fear that your agent didn't do their job well, fear that you're not getting all the benefits and services that you're entitled to. And because they know human psychology and what a massive decision this is for you, they know that it works. So here's my encouragement to you: don't buy it for a second. Hang up the phone, throw away the mailers, and actually talk to somebody that you trust who has your best interest at heart. So basically, she gets a call from some solicitor, right? Some agent in some call center somewhere around the country who just cares about her enough to share with her that her choice to go with Medicare Advantage is going to backfire. Now, if I got a call like that, I'd be worried too. So naturally, she reaches out to me because we've just walked through months of research together, like tons of emails, multiple phone calls, all to help her choose the best and right plan for her. So as soon as I read that email, I called her. And I recorded that call, by the way. And that's secret number two for cutting through the sales tactics. But before I get to secret number two, listen, if you're getting value out of this video, go ahead and click subscribe and hit that notification bell so you never miss a new video when it's posted. So secret number two, as of January 1st, 2024, CMS, Center for Medicare Medicaid Services, they require that all calls related to marketing, sales, and enrollment into Medicare have to be recorded. And to add to that, we're required as agents to read a disclaimer to you within the first 60 seconds of that call. So when I called her, I told her we're going to walk through everything one more time. We're going to go through it all again. But one of the first things I asked her was whether or not that person on the phone, if that guy was recording the call. I'm sure you can guess the answer. He didn't. Warning flag number one. Then I asked her if he read her the Medicare disclaimer. Not a chance. No again. Warning flag number two. And just so you can be prepared and you can know what to look for, here's the exact disclaimer that we have to read to you within the first 60 seconds of the call. We do not offer every plan available in your area. Currently, we represent a certain number of organizations that offer a certain number of products in your area. Please contact Medicare.gov, 1-800-Medicare, or your local state health insurance program to get information on all of your options. So if you come across somebody who doesn't read that to you within the first minute of the call, it is not compliant. So with my first two questions to her, she figured out this was a non-compliant and borderline illegal call. He didn't advise her that it was being recorded, and he didn't read the disclaimer. So time to hang up. These are the types of people that are calling you, people that aren't following the rules. And in my opinion, they should be banned from the industry. They should lose their license. This is what breaks my heart when it comes to this industry. And it's exactly why I'm doing these videos, so that you and everybody you know the tactics of the people out there. So now back to my client and our phone call. Remember how the guy on the line told her she shouldn't have taken that Medicare Advantage plan? Why? She said she was told two things. Number one, it's more out of pocket for her. And number two, she can't get out of it. So with that, I asked her one final question. Did he do a comprehensive analysis for you? Meaning, did he go through your exact situation, your medication list, your doctors and specialists, your needs and your financial goals? Did he go through any of that for you? You can probably guess her answer. Okay, wait a minute. Let's actually think about this. Let's break it down. So this phone agent who's not recording the call, who did not read her the required disclaimers, also didn't do any research into her personal situation. And that right there is secret number 3 for cutting through Medicare sales tactics. Your Medicare plan and what's right for you is as unique as your own fingerprint. Everybody's puzzle is different. It's so unique. That's what I love about Medicare. You cannot decide on a Medicare Advantage plan or a Medicare supplement without first doing that comprehensive analysis of your specific situation and your specific needs. Because there's so many factors that go into choosing what's best for you. That's true regardless of whether you choose Medicare Advantage or Medicare supplement. Things like your specific prescription drug mix, like how many drugs do you take? How many doctors do you have? How many specialists do you have? Whether or not you want to prepay for your healthcare or kind of pay as you go. I'm going to explain that all more in another video, but there's lots of factors that go into this. There's no one-size-fits-all approach to Medicare. That's why nobody can say this is the right plan or don't ever go with this plan. So that would be my question to this phone agent who didn't record the call, didn't read the disclaimer, didn't take any time to do any research for my client. How did he say her costs are going to be higher? What did he have to go on? Nothing. He didn't have anything to base it on. He didn't ask her one question about her medical needs. So what do? We walked through everything all over again, and she saw her exact numbers one more time, and here's what happened. Her numbers, her costs were actually lower in the Medicare Advantage plan. So after going through and seeing all the options again, all the plan benefits on both sides, again, she was 100% confident about her Medicare Advantage plan. But did you catch why? It's because it was based on the research. Like, we went through it all. We did a deep dive, comprehensive analysis, again, into her doctors, her specialists, her prescription drug costs, and ultimately what she wants out of her Medicare coverage. And we walked through it together, patiently. We never rushed through it. I made sure every single question that she had was asked and answered, because that's what an advocate does. That's what a good independent agent who cares about you should and will do every single time. Oh, and what about what that agent told her as far as not being able to get out of her plan? I actually answer it in this video right here. It's one you're definitely not going to want to miss.